Aloha everyone, welcome again to the Kapuna Network. My name is Dr. Russell Kim, and today I'm going to go over with you an oral health care system that I share with all of my patients. And the goal is to have their mouth not only healthy, their gums and their teeth from brushing and flossing, but throughout the day. The paradigm shift, I guess, as far as oral health is how can we keep your mouth healthy throughout the day? And this is a three-step process. And I want to go over that with you right now. Okay, so the first step, what you want to do is go ahead and floss. Why? Because most of the time people forget to floss, unfortunately. So I tell people the first thing you do is to grab your floss. And I just want to demonstrate here the flossing technique you want to do is that when you get the floss between your teeth, really pull it to one side and go below the gum line and go up and down along the sides of the gums, or sides of the tooth, making sure the floss goes below the gums. Okay, most people, when they do floss, from what I see, they just do this. And they think, oh yeah, I flossed. That's not flossing. That's getting food out from between your teeth. Flossing is when you're actually purposefully pulling the floss to the sides of your teeth, going down below the gum line and scrubbing below the gums, okay? So first step is to go ahead and floss. The second step is to use this rinse called Floss. What Floss is a neutralizing rinse. It's a pH of 7. It neutralizes any mouth acidity that you have in your mouth. And the reason why you do that is because the next step after this is to brush. But the other good thing about Floss is that it's really good for helping bad breath. The stabilized chlorine dioxide that's in here is really good for bad breath. And so after you rinse with this for 30 seconds, go ahead and get your tongue cleaner, or tongue scraper they call it, and brush your tongue. And then what I like about this one is that it has a brush and a scraper on the other end, so you can brush your tongue and then scrape your tongue afterwards. And so this, combined with that, will give you a nice fresh breath. Okay, so that's step number one. Step number two now your teeth, because it doesn't have any mouth acidity, now you're ready to brush your teeth, okay? So what you want to do is get your toothbrush, brush for at least 2 minutes, and like I shared in the last video, you want to brush at that 45-degree angle into the gums, these short back and forth motions to get in there, and brush your whole mouth for 2 minutes, okay? After you're done brushing, the toothpaste that I recommend is the Crest Regular Cavity Protection. And what's good about the Crest Regular is that it has sodium fluoride in it, so we know it's good to keep your teeth strong. The second thing that's in it is that it has hydrated silica, which is a mild abrasive, so it doesn't do damage to your teeth. Some of the toothpaste out there have like tartar control in it or some other chemicals, which can be damaging to your teeth and gums. So we just want it just to take care of your teeth. And the other good thing about it is that it's probably the least expensive toothpaste you can buy in the store. Okay? After you go ahead and brush and floss your teeth, the next thing you want to do right after is to go ahead and rinse. And you want to rinse with Listerine. The reason why Listerine is the best over-the-counter antibacterial rinse that you can get. It's gone through a lot of testing. It has the ADA seal on it. But what I tell people, and you rinse it for 30 seconds. If you can't handle it for 30 seconds, you water it down until you can. But what I tell people is that when you go to the store, there's generic brands of Listerine that you can buy. Just go ahead and get the generic brand. It's cheaper, and you don't have to buy the Listerine brand, okay? So that constitutes step number 2, okay? Starting with step number 3, you go ahead and rinse with ACT Anti-Cavity. The main ingredient in this rinse, again, is sodium fluoride. Same sodium fluoride that's in the toothpaste, but again, it's in a liquid form. And what this does is it gets into all the nooks and crannies of your teeth. And what sodium fluoride, what I tell my patients is that it's kind of like waxing your car. You're kind of putting a protective layer on your teeth. And you want to end with this rinse, and you want to rinse for 1 minute. So this constitutes the home care. It's a 3-step process, and you do it at morning and at night just before you go to bed is important. In the morning, I recommend after you eat. Some people, when they get up, that's the first thing they do is brush and floss their teeth. If that's your habit, just go ahead and stick with that. But ideally, after you eat your breakfast, do this. And just before you go to sleep, do this again. This will keep your mouth healthy. Now, in that last step, the last thing I talk to people about is the use of xylitol. I don't know if you heard of xylitol before or not, but what xylitol is actually an artificial sweetener. It was developed 100 years ago. And what's good about xylitol for your oral health, it does 4 things for your mouth, these dental researchers found. 1, it gets your mouth more alkaline than acidic. 2, it makes your teeth slippery, so it doesn't allow the bacteria to stick onto your teeth. 4, it eliminates the bad bacteria by making your mouth more alkaline. But the fourth thing, why dental researchers got really excited, is that xylitol works with your saliva to help repair cavities on your teeth before we can even see them. Like, I'll look on my x-rays, I don't see a cavity starting. I'll look in your mouth, I don't see a cavity starting, but maybe on a microscopic level, something's going on. Xylitol works with your saliva to kind of repair those. Now, when it first came out, Orbit's gum, a lot of sugarless gum companies started putting xylitol in their gum. But they failed to tell people to get the full benefit of xylitol, you need to take between 6.5 to 10 grams. Okay, so what does that look like? If you're looking, these are mints, and the mints show up like this. And what you want to do is that you pop 2 or 3 mints in your mouth, you suck on it, and as the xylitol dissolves, it gets into all your mouth. And so I tell people to strive for 5. To get that 6.5 grams, I tell people to strive for 5. 5 times a day you want to get exposed, because you need, if you're talking about mints, you need 13 mints a day to reach that 6.5 grams. Some people freak out, how am I going to take 13 mints a day? So strive for 5. I tell people to take 2 or 3 mints after breakfast sometime, 2 or 3 minutes before lunch sometime, 2 or 3 minutes after lunch sometime, 2 or 3 minutes before dinner sometime, and then 2 or 3 minutes after dinner sometime. You will get your 6.5 grams, if not more. And what you're doing is that throughout the day and into the evening, you're exposing your mouth to this alkaline, all those 4 benefits I talked about throughout the day. You're spiking your mouth into that alkaline healthy level, because whatever you eat, you can eat foods that are acidic or maybe not the best, and your mouth becomes acidic. This helps to bang your mouth back into the healthy zone. And so, how to take xylitol, you don't have to use just mints. They make gums, xylitol gums. The Spry brand was one of the first ones that came out with xylitol products, but there are other products out there now that have xylitol. You can take xylitol by sugar, they make it in a powdered form. And so the sugar, you can add a tablespoon into your bottled water, and you can swish that around and sip that throughout the day to get your 6.5 grams, I'm sorry. And the idea is that if you do this way, you want to swish it in your mouth. It's not drinking it, you want to swish it in your mouth 5 times a day. This is the most economical way to do it, but it's also the most humbug way to do it. This is the easiest way, but then you have to go to the store to buy it. Where to buy all these products? You can get it online. You can buy it on Amazon. If you want to walk into a store, all these products here you can get at Long's, Walgreens. Spry products or xylitol products you can get at Down to Earth, you can get at Whole Foods, and you can get at the Vitamin Shop. I started this program about 10 years ago after reading a dentist online, and I really like her system. It has helped my patients out a lot, and yeah, I just really enjoy sharing this with all of you. So thanks again for joining, and we'll see you next time. Aloha.